Many people consider their eyesight to be their most important sense.
Eyesight is one of our most important senses. We perceive 80% of our world's impression through sight. If our other senses such as taste, smell, or hearing were to fail, our eyes would best protect us against danger in the environment. Maintaining eye health is incredibly important in order to preserve your vision for life. The best way to do this is to see your ophthalmologist regularly and follow all instructions provided.
Imagine this. Your routine eye checkup turns into a trip to the ophthalmologist, who diagnoses you with macular degeneration. You are told you are slowly losing your eyesight, but are not given a solution or time frame. And to make matters worse, the only treatment provided is to take vitamins and use an Amsler grid once a month. That is what happened to Dr. Christopher Hakimian.
And so here I was with a grid, which he told me to look in the grid once a month and give him a call if it looks much different. And I'm like, so I'm supposed to wait till my eyesight fails badly and then I call you? And then take these vitamins, which, I mean, I was pretty unimpressed with them too. So I figured that there really had to be a better way than staring into a piece of paper and taking a vitamin every day.
Dr. Hakimian couldn't understand how in today's day and age, there wasn't a better measuring device on the market to test the rate of degeneration. So in 2010, Dr. Hakimian committed his small business, DXDT Engineering and Research, to develop a low-cost, PC-based system that would allow patients to measure the amount of change in their retina and compute quantitative metrics related to retinal health.
The quantitative retina test grid is a computerized replacement for an Amsler grid. It's based on the same concept. It provides you a grid. You can select the colors. When you use it, like an Amsler grid, the lines will appear wavy. Now what my system does is it allows you to use mouse operations to straighten those lines. And so you're applying this compensation to the wavy lines, straightening them, and the system will measure how much compensation you applied, and it'll remember that from week to week. Another thing it does is you can mark your blind spots, and then the system will compute what the total blind area is for your retina, and it'll store that and track that from week to week.
The quantitative retina health test grid designed by Dr. Hakimian is a first of its kind. Not only does the product allow for patients to test their retina health on a daily basis, it also enables them to take measurements at home. The system also supports large sample clinical research.
If I look into it every week and if I track things that way, then within a few months, I get a pretty good, I can plot that data, and you get to see whether your retina health is degrading or improving or staying the same.
The quantitative retina test grid is designed for use by patients. It currently sells for less than $20. The system empowers patients, allowing them to take a more active role in their retina health regimen. It returns metrics on a frequent basis, which allows trends in retina health to be easily identified by a physician or even by the patient themselves.
The computer seems to be a really well-suited format for this test. I can look into the center of the grid, and then I can use the mouse, and if I move that mouse around and if I don't see it, then I draw a circle around that area, and that's helped me identify a blind spot. And then once I've identified the blind spots, I start looking at the lines and seeing which ones appear to be distorted, and then when they're distorted, I drag them back and straighten them, and I can map one of my retinas in around 4 or 5 minutes.
A weekly window or evaluation into a patient's retinal examination or central vision would be helpful in earlier detection and potentially earlier treatment of conditions that can be sight-threatening.
Researchers in eye health can now use the system to collect data from much larger populations at a lower cost than ever before.
DXDT is going to be working with a doctor in the United States to deploy this system on web servers so people all over the world can access it and benefit from it to track their own retina health and to communicate the results to their doctors efficiently. and effectively. We're very encouraged by the response to the system and this new capability, which basically replaces a technology that has been the same since 1945.
For more information, visit www.dxdtengineering.com or call 301-520-1575.